Welcome to Employee Wellbeing Interventions. What does the science show actually works and doesn't? This webinar is part of our ongoing Psychology in the Workplace series. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect your questions throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You will be emailed the direct links for all of these items when they're available. Today's webinar will be co-moderated by Dr. Gloria Gonzalez Morales, Associate Professor in the Department of Psychology at University of Guelph and Research Director in Occupational Health and Positive Psychology Lab. Gloria will be moderating our Q&A session, and I will let her introduce herself, and Dr. Seth Kaplan will be our presenter.
Hello, so I'm here to present my esteemed colleague, Dr. Seth Kaplan. He's an associate professor of industrial and organizational psychology at George Mason University, and he has developed and evaluated several programs designed to improve the experience of work, especially in the public sector. Seth's research on workplace well-being has appeared in various journals, including Psychological Bulletin, Journal of Applied Psychology, and Journal of Management, and has been funded by sources such as the Army Research Institute. He serves as an associate editor for the Journal of Business and Psychology and as an editorial board member of 3 additional journals in the field. He earned his bachelor from the University of Florida and his master's and doctorate degrees in industrial and organizational psychology from Tulane University in New Orleans in the States. Other than trying to improve the experience of work, Seth's other great pleasure is his 9-year-old son. And I think that this summarizes quite well Seth's credentials and interests. So I think we're going to start with his presentation. Thank you, Seth.
Thank you very much, Gloria. Thanks everybody for taking the time to be here today and to view this presentation. As Gloria said, my research focuses on employee well-being and recently on interventions to enhance employee well-being. And the title of my talk today is Employee Wellbeing Interventions. What does the science show actually work and doesn't work? So many of you are probably familiar with the idea of positive psychology. If you're not, that's fine. Obviously, I'm going to go over it. But you probably are familiar with many of these kind of buzzwords or concepts. So the idea of mindfulness and meditation at work, the idea of emotional intelligence in the workplace, resilience at work, strengths and strengths finder at work. So some of my colleagues and I joke about kind of a workplace bingo almost. It's hard to go to some meetings and not hear some of these things mentioned: resilience, emotional intelligence, mindfulness these days. And then you hear about all kinds of interventions, 3 minutes a day for workplace wellness, and the idea that everybody should be this happy at work. I really enjoy my job, but I'm not sure I've ever looked quite like that at work. And the marketplace for well-being at work. So there's now many vendors who have products products to increase employee wellness and well-being, and there are consultants who offer products and services. And there's research about whether or not these programs are effective. So there's quite a bit out there right now, and what I like to do in this presentation is talk a little bit about the science of this. So people like Gloria and myself conduct studies, scientific studies, looking at these types of programs and looking at what works and what doesn't work so well. And I'll give you a bit of a spoiler here in that the answer in terms of what works and what doesn't is, for some of this, we don't know enough yet to be certain what works and what doesn't, but we do know some things, and we know a lot about best practices in terms of helping organizations determine what's working and what's not working. So in addition to kind of sharing some of the scientific findings, what I'd also like to do today is share some best practices for you and your organizations when you consider implementing some of these well-being interventions. So in terms of an agenda, I'm going to talk a little bit about the idea of positive psychology in the workplace and what it is. I'll quickly share an example of a study that some colleagues and graduate students and I did to give you a sense of what this looks like. And then I'll kind of give you an overview of best practices, a 5-step approach that incorporates these various best practices. And then we'll have some time so I can hopefully address your questions and comments. So I'd ask, what comes to mind when you think about workplace well-being? And I wish we were all together and I could hear your responses. But oftentimes when people think about well-being at work, and certainly traditionally within the research on this topic, what comes to mind is things like stress at work, anxiety, burnout, depression. And what I'd like you to think about is, what do all of us as employees want out of work? And what do people kind of ideally like to experience at work? And so if we think about stress and burnout and conflict and these generally negative experiences at work, is it the case that people just want to experience the lack of these things? So is kind of the ideal workplace kind of one free of stress and burnout and conflict? Is that kind of enough? Because that's certainly been the focus of research in terms of workplace well-being. If you think about stress prevention and stress intervention programs, treatment for burnout, employee assistance programs, conflict management, right? It's really about reducing these kind of negative outcomes or negative states. But another way to kind of think about this is maybe what people really want at work, and maybe kind of the opposite of things in stress and burnout, are not just kind of the lack of them, but really are things more like thriving at work, okay? And so thriving is actually a scientific concept, and what it really gets at is kind of both learning at work and a sense of kind of energy about that learning. So being excited to learn at work, flourishing at work, so experiencing positive emotions. So it's not just that we don't experience negative emotions, but we also experience positive emotions. Compassion at work. So it's not just that we don't experience conflict, but we experience compassion and good relationships at work. So the idea of positive psychology is really the idea that well-being is not just kind of the absence or lack of these negative states, but it's something more than that. Okay? It's also the presence of these various positive states. So I came across this cartoon recently, which I think kind of demonstrates the idea of kind of how we've traditionally thought about work and well-being at work. Okay, so again, we're kind of trying to move beyond that here. So here's one way to think about kind of the whole puzzle of employee well-being. And, you know, one could insert different pieces here, but this is, I think, a fairly kind of comprehensive portrayal of well-being at work. And so again, if you look at those red puzzle pieces here, that's largely what we focused on in terms of psychological well-being at work, right? We should try to reduce stress and reduce burnout, reduce negative emotions, and that's all true, obviously, but it really neglects a lot of other important aspects of worker well-being. So things like finding meaning and purpose at work, positive emotions at work, positive social relationships, getting one's psychological needs fulfilled at work. And so part of positive psychology is just really bringing to mind this awareness that well-being is more than, again, just the absence of these negative emotions. So if we think about some of the workplace factors that we know that research supports are important for well-being, so many of these are taken from this article, which you can see down here in the bottom right corner. And I included the link here, so you, I think you later will be able to access the slides and you can click on the article and read it. But these are some of the most impactful factors in terms of well-being at work. And I'll give you a chance just to kind of look those over and review them yourselves. And so in looking at these factors, you know, this is not, it's not rocket science, right? I mean, these are kind of intuitive, obvious factors, yet very few people can say they have all of these in their jobs, right? And so what we're really interested in doing, my students and colleagues and I, is trying to foster these factors in people's jobs. And some of these factors, many of these factors, I would say are largely beyond individuals' control, right? So if somebody, let's say, whether or not somebody has job security, okay, in many cases, there's probably not much individual employees can do about that in their job, right? So in looking at these factors, there's some that people can control more than others, okay? And we're really focused on helping people kind of get control over those factors that they can have more influence over, okay? And so if you think about how can people kind of enhance some of these factors, I would say there's two ways that they can do that, okay? One is that they can actually obtain more of these factors. So for example, if we think about the tasks that people do at work, okay, to some degree, people might be able to change the actual tasks they do, okay? They may not be able to completely change their tasks, but maybe they can tweak things to, for example, take on some additional tasks, or maybe get rid of some tasks, or change their tasks in a way to make them more meaningful, okay? The other way that people can try to enhance some of these factors is try to change the way they perceive or think about these factors, right? So if we think about the tasks we're doing, I could think right now I'm giving a webinar, right? And this is something I'm doing for an hour today, or I could think about this as an opportunity to help people and help you all help the people that you work with, right? So it's the same task, but I could think about it in various different ways, okay? And so what we try to do is help people in these two respects, help them in terms of changing the actual factors and in terms of changing how they think about them. And the two factors here that we really focus on are the nature of people's tasks, that's the work they do, and their relationships, their workplace social relationships. So that is with colleagues, especially, because those are the factors that people probably have the most control over here, okay, or in many cases at least. So I thought I'd go over a sample study just to give you kind of a sense of the type of work we do here. So in this study, we looked at, can two positive psychology interventions change people's mood at work? And can it actually help in terms of reducing absence related to illness? And so we had two different conditions or groups. So employees in the study did one of two things, okay? In one condition, we were interested in having people try to increase or enhance their social ties or social relationships at work. And so over the course of 4 weeks, people were asked to try to increase their social ties, and we provided them with recommendations for how to do so. So for example, we suggested try to do something social outside of work hours with a coworker or client. Instead of emailing someone, call him or her or go to his or her desk, right? And so people were asked to do several of these things over the course of 4 weeks. In the other condition, so a separate group of people were asked to keep a work gratitude log, okay? So they weren't asked to change anything at all. They were just asked to think differently, right? So to keep a log of aspects of their job for which they were grateful, okay? And the idea here again is nothing is objectively changing, right? We're just focusing on things or interpreting things in a way that we may not normally do. So this is kind of the typical setup that we follow. So we first administer a survey where we include measures of mood, and we have people report how often they're absent. And we use an online survey, and we always try to do this anonymously. That's kind of a decision you'd need to make depending on your particular circumstances. But this serves as our kind of pre-test or baseline measure. People are then assigned to one of these two conditions. So they either keep the gratitude log or they're in the social ties group. And they're in this group for 4 weeks, and they're asked to do each of these activities, or I should say either of these activities 2 times per week. So for example, to make an entry into their gratitude log 2 times per week for 4 weeks. And we send them instructions and email reminders. After the 4 weeks, we give them the same set of surveys again, and then we give them the same set of surveys again a final 4 weeks later to see if any changes last beyond the study. Okay, so I have a quick question here for you all. So of these 2 activities, which of them do you think would be more effective for improving mood at work? Or do you think they're equally effective, or that neither of them would be effective? Okay, so the results are that 57% of you said B, engaging in activities to increase social connections at work, and 43% of you said C, that both are equally effective. And actually, we were kind of surprised at this as well. The answer, what we found is A, that writing about what people are grateful for seemed to have, was actually the condition that had the significant effect. Increasing social connections did not have a significant effect. And in fact, increasing social connections, some people found it somewhat of a nuisance, whereas people had very positive reactions to the gratitude condition. I shouldn't say everybody reacted negatively to the social connections condition, but being grateful at work or expressing gratitude significantly increased positive mood and significantly decreased negative mood. And this is consistent with a lot of psychological research literature that I'm sure some of you are probably familiar with, showing the benefits of gratitude and keeping a gratitude log. So we thought this was a pretty interesting finding. So just to show you some comments from study participants regarding their experiences. Oh, I'm sorry about that. Okay, so the gratitude seemed to help, and this is not to say that it helped everybody, but it seemed to help a good number of people. Okay. And many organizations are kind of buying into this positive psychology approach, not necessarily just these particular activities, but especially mindfulness is very big. Some of you probably know. So Google, for example, has a large mindfulness program. The US Army has tried a large positive psychology program. The Mayo Clinic, Aetna, the large insurance company, all have major wellness programs that incorporate components like this. So are these interventions really the panacea? Can they solve everything, or can they really dramatically improve everyone's psychological health at work? The answer is no, I would say not. So some conclusions from the research is that these interventions can work, but they do not always improve outcomes. And even when they do work, it's sometimes difficult to know why they work. Okay? So my goal really for the rest of the presentation is to provide you some best practices to implement and evaluate these interventions. Okay? So best practices to try to make them successful, and also to evaluate whether or not they are successful. Because again, just because they're successful in some cases does not mean they're successful in your particular organization or for all individuals. So let me start with the first of these 5 steps. And this is one of the kind of biggest mistakes that we tend to make. So step 1 is determine the target or targets. And what I mean by that is determine what it is that you feel needs to be improved, okay, or needs to be worked on, all right? What often happens with these kinds of interventions is, instead of finding what it is that needs to be worked on, instead we just take this new concept like emotional intelligence and we apply it, and we expect it to kind of cure or solve or improve all kinds of things that it's not really necessarily meant to solve or improve. So I like to refer to this, well, this is not my term, but I think it applies here, as the kind of shiny new object effect. And I think this definitely plays out in this space, the positive psychology space. So I like to think about this as kind of analogous to, let's say, a new drug, a new medication. So imagine there was a new medication that was found to be effective for, let's say, blood pressure, okay? We would never take that new effective medication and start treating people with headaches for it, right? But that's exactly what we do with these types of interventions, right? We take these interventions and apply them without really considering what the problem is that we're trying to address, okay? So it's essential to try to start with the problem, identify what the problem is, and then try to find the interventions that will be most effective, okay? And the way to do that is to use surveys, so to administer surveys that include measures of various psychological concepts, and then try to identify those where there's the most need for improvement, and to conduct things like focus groups, right? Talk to people, find out not only where the problems are, but find out what the activities are that they would be willing to do or they'd be interested in doing. So let me give you a quick story. This happened to me recently, some colleagues and myself, of when we didn't follow this approach and what happened. So an organization approached us and they said they would like to implement an employee well-being program. And the person at the organization who was kind of our point person was especially interested in implementing a happiness program. This individual had come across a New York Times article about this class offered at Yale University. Some of you may have seen this article. Yale's most popular class ever on happiness. And what this class is, you can look it up online. This class is being offered, a similar class at various universities, but throughout the class, they learn various positive psychology practices, like the gratitude one that I mentioned. And this individual in the organization really wanted us to implement something like this for her organization. And we said we would consider something like that, but before we did that, we wanted to talk to the people in the organization, the people who would be participating in the intervention. So we held some focus groups, and it turned out that the people in the organization were, well, they weren't quite this mad, but they were fairly disgruntled. And they were especially unhappy with the leadership in the organization, to the point that a few people actually were in tears during the focus groups. They were really quite upset, and they really felt that there needed to be some sort of organizational change. So we went back to the organizational leader and said, we don't think that implementing a happiness intervention here is really the best solution. But the organizational leader was kind of insistent that this would work. And so we kind of tried to talk her out of it, but she insisted. And so we implemented this happiness program, and participation was dismal. So initial participation was about 15%. And that's just initial participation. And we ended up having to actually end the intervention, end the study, because so few people participated. And I think that's largely because this was really a poor fit, okay? The solution didn't fit the problem, okay? So in a case like this, something structural really needed to be done, or some sort of leadership development perhaps, but a happiness program was not really the answer, okay? So again, I use this to make the point to really start with what is the problem, start with the target. Next, you need to decide on an approach of these various positive psychology activities. So this is a second question. Which type of workplace activity tends to be most effective for improving well-being at work? 14% of you all selected A. Nobody selected B. 14% of people selected C, and 71% of you all selected D. And D is indeed the correct answer, okay? So the evidence does not clearly show that a particular type of activity is better than the other types. It's very much the case that different activities work for different people. And this is kind of obvious and intuitive, right? But if you think about it, some of these activities are really so popular these days, like mindfulness, that one can come away with the impression that everybody should be doing mindfulness meditation, right? And, you know, if you're into mindfulness meditation, that's great, but I don't think it's necessarily the answer for everyone, right? So people need to find what works for them, okay? So just to give you some data on what companies tend to offer. So this was the results from a survey from, it was a large survey of thousands of employees. So 84% of employees said that their company offers a one-size-fits-all wellness program. So there really was no choice in the program, okay? 56% of employees said that they had received irrelevant support, wasting time and money, okay? And 80% of them said that delivering more personalized programming would motivate them to participate more, okay? So the takeaway here is that what works for one person or what interests one person is not necessarily what interests others, okay? And so I like to think of this as really offering a buffet, okay? Providing various types of activities. And what we've done in one study is we had people it was a 4-week program, and for each week we had people try out a different activity, okay? So in 1 week they tried out mindfulness. Now 1 week is not really enough to see the benefits of mindfulness, but it's at least enough to get kind of a taste of it. In 1 week they did the gratitude journaling, etc. And then people could decide kind of what they wanted to continue doing beyond that. But again, offering just kind of one activity is probably not going to be most effective. Step number 3, set up the program for success. So I think it's really important to keep in mind that these positive psychology tools are just that. They're tools, not the whole wellness toolbox. There's much more to employee wellness than these particular tools. As really any health or safety initiative, as you all probably know, these are only as effective as how much support they have from management and supervisors. So if you have some sort of mindfulness meditation initiative and supervisors don't let employees participate in it, then you know, it's not going to be really effective. So these programs really need to be part of and integrated with kind of a culture of health and well-being and of something more systemic. Something that I really can't emphasize enough, and I'm sure this resonates with a lot of you, is whatever is done needs to be quick and convenient. And this is something that we've run up against study after study. Quick and convenient is key. As you all know, people don't want kind of another extra thing to do. And so I'll provide some suggestions here, but this is really fundamental. So one of the things you will find, and I'm sure many of you are aware of this with other programs, but it's certainly the case for wellness programs, is that participation is an issue. It is oftentimes difficult to get people to participate in these programs. So if you think about wellness programs in general, what the general finding is that people often participate in health screenings, but getting people to participate in activities or interventions is much more challenging. So these are results of a survey done by RAND, which is a large organization here, and it's a very good report. but these are the participation rates for different types of wellness program components. So you can see fitness, which was the highest, had a participation rate. This is across many organizations. The average participation rate was 21%. Okay, and it only kind of gets worse from there. Okay, so getting people to participate in these programs is definitely a challenge, and this goes back in large part, I would say, to the focus groups. Find out what people are willing to do and what they want to do, offer people a lot of options, and make things quick and easy. So in terms of encouraging participation, so there's no right or wrong answer here, but this is really just to get your thoughts. What do you see as the largest challenge for participation in programs like the ones I've been talking about in your particular organization? What would you see as people's, employees' biggest concern or obstacle to participation? The results are that 33%, so 1/3 of you selected A, they do not think they would benefit, and 2/3 of you said B. They do not think they would have time to participate. And those are probably around the numbers that those are fairly consistent, I'd say, with what I've seen in organizations. Time, obviously, a very big issue, and people not thinking they would benefit. And I would just say, with regard to not thinking they would benefit, I think one of the challenges here is that, first of all, these are really kind of subtle things. A lot of these, like keeping a gratitude log, I mean, almost sounds maybe juvenile in some cases, and I oftentimes hear just how surprised people are that doing something so simple benefits them. But oftentimes it does take doing so for a few weeks at least to really appreciate the benefit. So I think there is a challenge there. But time, I definitely appreciate that as well. It's kind of interesting to me that nobody said the security of the data. That sometimes obviously can be an issue with health kind of data. Okay, so how can we increase participation? So I'm sure all of you probably have a lot of ideas here as well, and things that have worked for you. Some thoughts that are from the literature and things that I have found effective. So there's been a lot talked about with regard to providing incentives, okay? So most of this has been with regard to things like weight loss or smoking cessation. So for example, actually paying people to go to the gym or paying people to stop smoking. And you can think of incentives, either you can have incentives for beginning the study, okay, or participating in the study, or incentives for actually achieving some outcome, all right? And the evidence on whether incentives work is actually rather mixed, and we're kind of waiting for more data to come in to see whether or not they're effective for these kinds of programs. But the evidence does suggest if you're going to have an incentive, something like a t-shirt or a gift certificate is probably not going to be sufficient. So in the US, incentives often take the form of reduced healthcare rates, which I think probably is not applicable in Canada. But that's something to potentially consider. Something that I think is especially effective, because it really counters the time obstacle, is to integrate these activities with work activities. So instead of this being another thing, integrate this with work activities. So for example, with regard to the social ties, it doesn't have to be something extra. It can be as you're working with your team or your group on a project, think about ways that you could foster collaborations with new people in that team, okay? So it's not an extra thing. It's actually beneficial for you both socially and in terms of your job. Meeting with supervisors about wellness. So imagine, for example, that during performance management or performance evaluation meetings that supervisors actually mentioned or discussed people's wellness and participation in wellness programs with them. And certainly having supervisors participate in the programs can kind of be a good model for having other employees participate. As I said, make it quick and convenient. So little things like try not to have things in distant buildings if you have multiple buildings or too far away, right? Little things like this matter. Make it quick and convenient for people. Oh, I apologize. Have wellness coaches. So I believe there actually may be some wellness coaches on the call here, but especially if you're kind of offering a buffet, have people there to support employees as they kind of consider different options and kind of help them engage in these activities. Things like make it a competition. So, you know, which department is having the most participation in these various activities. Okay. So again, I'm sure you all have some ideas here as well. But I like to think about this as kind of starting small, kind of little wins, and hopefully it kind of grows kind of organically as well. So I'll give you an example of a kind of quick and convenient activity. So this was an app that was developed, a mindfulness on the go app. And this is the study describing it in the Journal of Occupational Health Psychology. So you can find the article here. But basically, they developed an app for use at work, and they found that it impacted things like distress, job strain, and as well as, I believe, blood pressure. So you know, it can be done. There are kind of ways to make this more accessible to people. Evaluating programs. So this is really an essential step, again, especially because what works for one context or workplace may not work for another. So imagine employees begin to keep a work gratitude log and report feeling happy at work. Did the log actually help them feel better? We don't know, right? So there are various possibilities here, but we should probably find out, right? So maybe keeping the log helped them feel better, but maybe it's just the case that, well, when would people start to do something like this? Well, maybe it's when they're feeling especially badly, right? And so maybe people feel better over time anyway, and they would have felt better even if they didn't keep the log, right? So for a lot of these interventions, again, there's not really yet enough research to tell us what works and what doesn't, and what works in one setting may not work in another setting. And so, as many of you probably know, kind of the gold standard to evaluate these different activities is to do an experiment. And this is really increasingly what some organizations do. Google, for example, is kind of famous for doing this. When they do introduce an intervention, they don't just kind of put it out there and hope it works or assume it works because people say that they like it. They do an experiment where they have different conditions. And this doesn't have to be a big experiment, right? But imagine that you have multiple units or departments, and so some of the units, let's say, are asked to keep a gratitude log and other units are not. And then after a few weeks, you measure whether there are changes in mood or absenteeism in the two groups. It's fairly easy to implement something like that, okay? And then the fifth step, I would say, in thinking about any of these activities and really any kind of intervention, the way I like to think about this is as kind of constant improvement. So the idea here is that you administer the program, you evaluate it, and then you tweak it and improve it, and then administer it again, and then again, evaluate it, tweak it, and administer it again. And so each time we administer it, we're improving it. And this has been called the act, plan, do, study cycle of constant improvement. And so this cycle occurs each time that we administer the activity, any activity. And I have the link to the website here where they talk more about this. But again, a lot of organizations are moving towards this. Instead of having kind of one huge initiative, they kind of do this as small steps. So a small trial, this could be 15 people. See how it goes, make some tweaks, try it again with another 15 people. Make some tweaks, do it again with another 15 people, right? And so the idea here is instead of kind of one big initiative to, again, kind of tweak it as you go. And then eventually you can kind of scale up to a larger group. So these would be some of the key takeaways that I hope people come away with. Again, well-being at work is more than the absence of stress and depression, etc. These activities, one of the nice things about these activities is they're easy to design and they're inexpensive to implement and to complete. So again, if you think about kind of traditional stress management programs, this is not necessarily taking the place of them, and I'm not advising that, but there's really very little harm, I would say, usually in completing these activities, and so it's oftentimes kind of worth a shot. Again, they're tools in the well-being toolbox. They're not. They shouldn't be the only well-being interventions or programs in place. So as I said, using a buffet approach is advisable. Start with the target or the outcome, not with the kind of new approach. And talk with people. I find interviews and focus groups especially helpful. Find out what they will do and what they need and what will actually lead to participation. And plan, do, evaluate, act, change, then plan the next phase, do it, etc. So I really appreciate you taking the time to listen. If you have further questions or interested in talking about research collaborations, please feel free to contact me. I'm always happy to talk about this stuff. And I guess I now will be able to address some of your comments.
Thank you, Seth. Okay, so it looks like we have a couple of questions over here. First of all, someone is asking for the online survey that you mentioned at the beginning that was measuring moods in the workplace. They're asking what criteria was taken into account, what type of questions were asked.
Sure. So this was a measure from the research literature, and it basically just asks various kind of positive types of mood and various negative types of moods at work. So Positive moods would be, I don't remember the specific items, but it's public domain. I can send you the reference if you'd like. But positive moods would be things like, I'm trying to think what they were. Happy, excited.
Okay.
Yeah, those kinds of things.
Okay, thank you. Then this other question is related to the happiness program that failed in the company that you mentioned. Did you receive any negative feedback? Could you talk about what were the weak points that were not tailored to that company specifically, apart from what you discussed already? And what type of company in terms of industry it was?
Yeah, it was an interesting context. So it was I can't disclose the name, but it was a large public organization that does some really high level work, I would say. And I was kind of surprised because, you know, given the type of work they do, I really didn't know how this initiative would be met. And, you know, going in there and talking to these folks who were really, I mean, very, very impressive about some of this stuff, because, you know, this stuff can come off as kind of soft, I think. I really didn't know what to expect, but they were really receptive. And when they, I mean, we had some of these focus groups and people were literally crying because they were so unhappy about the leadership in their, so we didn't get much actual feedback about the project other than, I mean, the people we spoke with during these focus groups, they were receptive to it, but it was clear that the leaders, there was a leadership issue which this program was not meant to address.
Exactly. Yeah, I usually think about this as a foundation. Like, do you have the foundation to build the house? Because if there's not a good foundation for the organization in terms of leadership, good structures, good culture, no happiness program is going to make. Like, you can build something, but it's going to collapse, right?
Yeah, I think that's a really good way to think about it. And in fact, I think, you know, there's always a concern even of, you know, this being met with kind of cynicism and just kind of being kind of a shallow attempt to deal with substantive problems. So yeah, I think that's a good way to think of it.
Yeah. Okay, and then the last one that I think that is a good one for kind of wrapping up. They're asking, what barriers do you usually encounter while doing research in this field? And in terms of what is your opinion of the type of facilitators that would allow you to collect sufficient data in order to make a decision on whether some programs are more efficient than others?
I think the barriers, well, it's funny, you know, I think some organizations are just wary because I found they don't really necessarily understand that my goal here is just to improve well-being and do research. I think a lot of private organizations, well, public too, I imagine, they're kind of solicited by so many people who are trying to sell them things, and you know, I'm not, and I think they kind of have a hard time kind of wrapping their heads around that sometimes. And I think the logistical issues are kind of a challenge. So I think it's really critical to have kind of a champion within the organization, a point person who can facilitate the logistics, you know, setting up, you know, I can set up the survey, but somebody who knows the best way to distribute the survey and those kinds of things. So I think just kind of the details, the logistics are a challenge. In terms of, you know, when there's enough evidence, I really do believe I would always do a pilot test first, at least, you know, a small scale study, and hopefully get, you know, at least initially favorable data before doing something on a larger scale.
Yeah, I agree, especially with these specific interventions. Okay, well, I think that that's all the time that we have today. Thank you so much, Seth, for sharing this very interesting webinar with us. I think that we have learned a lot before we start putting resources into interventions that may not work, and to be sure that we have all the steps covered. Thank you so much.
Yes, thank you, Seth, for demonstrating the importance of implementing evidence-based practices in the workplace to increase the likelihood that the program in place will be effective. Excellent webinar, and thank you for sharing experiences that you've encountered before. And Gloria, thank you for moderating this webinar and for the great contribution you're bringing not only to the coordination of the psychology in the workplace series, but also its content, since you have presented one of the webinars in this particular series in regards to positive psychology and work stress and when stressors actually make you grow. A special thank you to our audience as well for joining us.